Hello everyone, Assalamu alaikum. My name is Dr. Asad Sultan Khan and I'm a global shaper from Islamabad Hub. Davos Lab in Badis Sabah is an initiative to explore different pillars of society and to tackle those pillars and understand the reality behind it. We, as a part of the World Economic Forum, are organizing various dialogues all around Pakistan and abroad to explore these issues. So for Islamabad Hub, today we're hosting an event to tackle mental health issues during the COVID-19 pandemic. During the pandemic, we've of human life. We've had the loss of jobs. We've lost people around us. We've lost almost everything known precious to mankind. And thus, to explore all of these issues and to have come up with a sound approach to in dealing with these mental health issues during the pandemic, we and I am extremely honored and delighted to welcome Dr. Faisal Rashid Khan today, who's a consultant psychiatrist and who's done tremendous amounts of work and explored this issue within its very depth. Without further ado, I would like Dr. Faisal to introduce himself and then we can formally begin.
Thank you, Asad, for this opportunity, and it's a privilege, it's an honor. But more importantly, we are here to talk about mental health, which is so essential ever since and especially in present times. So I'm Dr. Faisal Rashid Khan. I'm a consultant psychiatrist. I did my MBBS from Rawalpindi Medical College, and then I did my specialization from Institute of Psychiatry, Benazir Bhutto Hospital. It's been 15, 16 years I've been helping people with mental health problems and mental illnesses, and 10 years that I've been associated with undergrad and postgrad teaching of psychiatry. My special area of interest is grief and psychotrauma.
Right. Thank you so much, Dr. Faisal, for being here. I would like to begin our today's session. So first of all, when we talk about mental health, we see a lot of talk around, being strong-minded. People use various terms to describe the whole phenomena, such as, being emotionally strong, and you have to keep your emotions in check, and you have to deal with the stresses in your life, having good sort of an emotion. So there's a lot of confusion behind this whole topic. First of all, I would like to understand that in today's world, what does it really means to be emotionally strong, in your opinion?
Well, I look at this emotional strength, being psychologically strong, in a different way, slightly, rather in terms of emotional intelligence, the EQ. And there has been great progress in this regard. And we don't have to be unnecessarily strong or brave. Rather, we need to be cognizant of our emotional states. We should be able to understand, get in tune with, get more in touch with our emotions, where they're coming from, why we are feeling the way we are feeling right now. And at the same time, we are able to understand and respond to emotions in other people, the people who are around us. And that's so important for our working at our workplaces, in our relationships, in our social interactions. And there is scientific evidence now that people who are more emotionally intelligent, who are more self-aware, they go further in their careers, they go to higher ranks. So I think rather than talking about the strength, or to me, this is the strength, being more in line with your emotional states, because that's so very human.
Perfect. Thank you so much for sharing it in such detail. My next question would be regarding the most serious impact of COVID-19, and that's the loss of precious human lives. We've given a lot of lives, a lot of loved ones have gone because of the virus, and because of the pandemic. And secondly, because of all these stresses all around it, the virus itself puts the biggest drain to our mental health as a humanity itself. What do you think about it?
When it started, we never knew that it would last so long, and we still don't have an end in sight, and especially for low and middle income countries like Pakistan, Bangladesh, India, Africa. But it has affected life, that's a very small statement to make. It has hugely impacted lives, businesses, relationships, the way we our work, everything. And the fear that it has instilled, fear of getting an illness, fear of dying. That's it's not a simple flu, as it was suggested in the beginning. It kills, and that's why we are also worried about it. That's why we're having lockdowns. That's why we're having mass vaccinations. So something which affects so badly, something which creates so much fear, anxiety, and uncertainty that is bound to impact our mental health also. So it's this pandemic is as much a physical health issue, as much equally it is a mental health issue.
Right, right. And before I delve deeper into the having a approach to dealing with all sorts of issues, I would first of all I want the audience to understand what basically and means by stress itself. Stress could be anything that you can have in your workplace. It can be at your home. It can be wherever you're working, and it can be due to the various effects of the virus itself. So, in your opinion, what is stress and how can we cope with it in a more humane way?
Actually, firstly, we need to understand that we all face stress on everyday basis. Some of the stressors are mild in nature, some of the stressors are severe in nature. So nobody is immune to stressors, nobody is immune to stressful reactions. We need to understand that not all stress is bad. There are certain amount of stress which is positive, which is productive. So if I have to get to work in the morning and it creates stress for me, that's a positive stress, because otherwise I wouldn't reach my office on time. If I have an exam coming up, it's a positive stress because it pushes me to study, to work hard. And thirdly, we also need to understand that stress is a response, because as we can see, a similar stress affects different people differently. Even, for example, if someone has passed away, a father passes away and he's left behind 4 children. All 4 children living under the same roof would be affected differently by the same stress, and that is their father passing away. So stress is a response, and we all respond to stresses in life um, in varying ways, depending on our personality, depending on our life circumstances, depending on our coping mechanisms, depending on our genetics. So it's a multitude of factors.
Right, right. And I can completely agree with you here. So, since I've been working at, one of the largest public sector hospitals in Rawalpindi, I face this issue very, directly in front of my face. I've seen families coming up who've been, doing just fine before, and just having a loss of their father, their mother, their sister, their brother, whatever it is. They just resorted to, a very hardened and a very disrupted quality of life, and now they don't know what to do anymore. They cannot function mentally, they cannot function physically, obviously. And they do not know what to do anymore. And this is just not me who's been seeing this all around. This is everyone in this pandemic, since we have such a big amount of people dealing with these issues. In your opinion, what should those people do? What sort of an approach those people need to have?
Okay, so before I answer this, I think just a little um, brief take on how stress affects us. Stress affects us psychologically, like with all the anxieties, the fear, what is going to happen. I feel overwhelmed. I feel like everything is going to go bad. I feel sad. I feel hopeless. I feel helpless. These are the psychological components that happen. Similarly, stress can affect us physically. I can have headaches. I can have body aches. I can have gastric problems. I can have chronic diarrhea, constipation. I can have issues related with muscular pains, cramps. You mean anything, even skin diseases. Women can have menstrual issues. Stress can affect any part of the body, the mind, the brain, the body, everything. So, depending on people's personalities, their underlying personality traits get enhanced at times of stress. So, coping, dealing with stress has greatly to do with our culture, with our family dynamics, with our current um, uh, status of mental health, and it's important to fall back upon how you have dealt with stresses in the past. There is no one size fits all formula. Every person can have different resources to deal with stress. So some people can bring into use their cultural beliefs, their religious beliefs, their spiritual beliefs. That might be a source of coping for them, healing for them. Some people can resort to exercise, for example, um, uh, watching movies, reading. These are all, I'm talking about the healthy ways of coping with stress, spending time with their friends, spending time with their families, spending time with their kids. That could be another way of coping with stress, and they're all legitimate. They're all fine. But on the other hand, we can have unhealthy ways of coping with stress. And if you say we can delve into that.
Right, perfect. Further exploring this singular issue, you're right when you say that we face stressors all around our life. We face stressors from the very beginning. We face stress every single day of our lives, whether it's it's workplace, it's at our homes, it's the people we deal with every single day. So we face it every single day. But especially talking about COVID-19 and the pandemic blooming around, we've no greater stress has ever been faced because the humanity as a whole has had a loss of lives, loss of precious human lives. So when people come up to you and they tell you that we faced the loss of a loved one in our family, that's the most biggest stress they can ever have in their life, and that's something that can exactly put them into an existential crisis. During that scenario, what is your approach in handling those sort of patients? And then what's the formula or criteria or scenario that you provide them?
Acha, firstly, I wouldn't call them patients. They're people who have suffered a loss. They're passing through grief, because now we are specifically talking about bereavement, people who have lost their near and dear ones. First thing is to normalize what they are feeling and what they are thinking. Anyone in this situation, you see, as I mentioned previously, uncertainty, anxiety in present times is very normal. It's not an abnormal thing. It's not a disease. We all are reacting um, to a very abnormal situation in our life. So when it comes to loss, similarly, um, when someone leaves, feelings of sadness, anger, bitterness, um, loneliness, anxiety, fear, they are all normal. They can last for weeks, they can last for months. Yes, there is a cutoff point when it becomes too much and you need professional help. But uh, all the normal processes of grief, of loss have been disrupted due to this pandemic. People are not able to care for their near and dear ones. Someone who's admitted in the hospital is on vent. We cannot visit them. We cannot offer condolences to the family. I lost my childhood friend. I couldn't go to his funeral because his father stopped me that I've lost a son. I don't want others to contract the virus. I visited his wife and children after, I think, 20 days. And um, so people couldn't come with, for the chihlam, for the for the Soyam. So all these culturally legitimate, culturally prevalent systems of grieving have been badly disrupted. People avoid visiting people who have contracted the COVID. And now in the third wave, we are seeing that not one person is getting infected. It's the whole family, because it's so virulent, this strain, that the whole family gets infected. So who buys the groceries? Who goes outside? No one can go outside. People don't visit them. Even when you go to the graveyards for the funeral, it's just few people who are allowed, and the way and the dead body is not even allowed to come to the house. They take them directly to the graveyard. So the process of grief gets more complicated. It gets disrupted. It becomes more uncertain, and people are finding difficult to find a new meaning. People are going to adjust to this new reality because human beings are by nature very resilient, but it's going to take time. It's a transition we all are going through.
Right, perfect. And so talking generally about mental health in Pakistan, generally what we've seen all around Pakistan is people often ignore this topic. People often ignore, even accepting that, there could be such a thing as mental health issue. People think that, and people often at times don't even understand that just like we have a physical body that we train, into gym, we do a workout, we walk, we run, we take a good diet. That's all for our physical body. But what do we really do for our mind, right? And when often at times, whenever this topic comes up, it's often ignored. What's your take into this?
You see, mental health all over the world. It's globally a new phenomena. When I say new, I'm talking about the history of mankind, the human race. Um, it's just the last century that we had Freud, we had biological psychiatry taking over, then the behaviorists, behavioral scientists putting in their theories. So Pakistan, the subcontinent, the African countries who are kind of lagging in economic development and human development index. The lag here is even more pronounced. People have these beliefs, cultural beliefs, religious beliefs, which are not um, scientifically relevant, I would say, who are not in line with the modern world thinking, which creates a great barrier to them seeking professional help. They believe people all over the world believe in myths. They believe in supernatural powers, but the way it is practiced in our part of the world, that creates a lot of hurdles for people seeking individual help. People visiting, you see, there is great acknowledgement of the fact that we are having some psychological problem. We don't need to visit the doctor. Rather, we need to visit some healer. That's why people go to the shrines. That's why people go to peers and fakirs, because they know there is some mental health issue, but they don't go to a psychiatrist. But you see, things are changing. The new generation is different. The generation you come from, people younger than you, they are connected globally. They have access to the modern world technologies, the information, and I see great hope. I see a great change, a transition happening right now where people are more open about their mental health, people are more open about their vulnerabilities, and that's what is happening.
Right. Thank you so much for sharing that, Dr. Faisal. Coming back to the pandemic once more, I really want to understand it in more depth, right? So, we've already formalized that this pandemic is not going to end anytime soon. It's going to take a lot of time, possibly years. Although mass vaccination has begun, we're very hopeful that the trend is going to shift, and soon humans are gonna be okay with the virus itself and living through it. But before that happens, before that, normalization, before people finally accepting it and finally resuming life activities in a new modern world, before all of that happens, before life begins, smooth again, this time where people have to go through it, go through the pandemic, go through the loss of their loved ones, one after another, go through the loss of their jobs, go through the loss of so many precious things in their life. Um, could it there be a one, could it there be a, one agenda? Could there be something like a structured approach of dealing with such things? Because it's just not an issue with one or two, individuals. It's an issue with all of humanity at this point. Just to summarize all of our, the discussion that we've had, just to summarize, a 10-point solution or anything that can, be that is tangible enough for everyone to follow, no matter if, the individual is coming from a teenage group or if it's coming from an, older group. So what would be your take for this?
You're just talking about the pandemic or the mental health as a whole in Pakistan?
So I'm talking about the pandemic right now. Until and unless things go normal once again, during this period, people are facing extreme bouts of anxiety. People are facing extreme amounts of mental health issues. So is there a one pager, a solution for them, and a daily, an approach which includes practices that they can follow every single day to make sure that they're doing just a little bit fine?
Okay, so now I'm talking at individual level, what you can do. I'm not discussing what we need to do at societal level, what the government needs to do, what the international community needs to do. So at individual level, first you need to understand that we all are in it together. So none of us is alone. Many of us are facing similar stressors, similar problems, and it is irrespective of age and gender. It is irrespective of socioeconomic background. It is irrespective of what kind of work we do. We all have challenges of similar intensity, if not similar nature. So we are not alone. Secondly, what we are feeling, be it feelings of anxiety, sadness, loneliness, helplessness, what we saw in Palestine a few days back, and people were sharing their emotions, their helplessness. Now you see, these are very normal human emotions, and that's how we feel when we see misery, adversity, crisis. So second, it's all very normal what we are feeling right now. What you can do is to have a structure to your day at a minimum. Whether you're studying, whether you're working from home, you're a single parent, you have to share work with your spouse, you have children who are doing homeschooling, you have a shop, whatever you are doing, have a structure. You should have a work-life balance, a study-life balance, how much hours you give to your study, how much fixed hours you give to your work, and rest of the time you have to take care of your personal self, be it hygiene, be it your workout routine, be it your food, be it your sleep. So fourthly, a good amount of sleep, healthy diet, a workout, a physical exercise, a sports routine. These are the things which will help you deal with your difficult emotions. These are the things which will give a structure to your day, even when there is no structure outside. And they will give you a certain amount of control over the environment, because we have lost control how things are in the outside world, but we can definitely have a control to our day-to-day works. And lastly, I think being connected. There's a difference between social distancing and how we remain connected to our friends, our family. There are different means. This pandemic has opened new windows, new doors to how we connect with each other. Students, teachers, friends, families. So there are 100 different ways. to connect, even to counselors, even to, I've seen people doing online counseling in a big way in these days, through messaging, even through texting, through emails, through video calls, through audio calls, and face-to-face, of course, as had been going before. So remain in touch with people, don't isolate yourself, and consider it a very human, a normal experience that most of us are going through. I'm not talking about moderate or severe mental health problems, which fall in a different category. I'm talking about 90% of people who go through normal emotional states.
Right. Thank you so much for sharing this, Dr. Faisal. I feel like this was one of the most important things that needed to be addressed because we've addressed, we've talked about how society should work about this, how the world should work about this, how things are going right now, and how things are going to go as expected. But at an individual level, especially when I deal with patients all around, in the hospital, and they come up to me and they share their life stories, they share their losses, and they share their trauma, their emotional and mental trauma. At times, more than often, and having share a vast number of patients at my disposal, it gets really difficult to give them a one pager, or give them a solution of what they can do at an individual level. So thank you so much for sharing this. I feel like this is one of the most important takeaways for anyone listening to this talk right now. All right. So my next question is about the mental health resource centers available to the mass public. When we talk about mental health resource centers, I want to understand and I want the audience to know if there are any centers out there who are free of cost to the public, where people can just go and they can share their emotional trauma, and it's all free of cost because money and the budget comes a long way, right?
Yes, that's absolutely right. You see, before I answer this, I want to set the stage for where we stand, even before the pandemic began. So Pakistan is a country which spends 1% of its budget on health, and out of that 1%, only 0.1% is spent on mental health, and that also for severe mental illnesses which require inpatient care mostly, and OPD outpatient care. So the spending on government side is minuscule. We have only 400 psychiatrists in the country for a population of 22 crores, maybe 800 psychologists for a country of 22 crores, and they're mostly based in big cities. Peripheries don't even have qualified psychiatrists or psychologists to cater to their needs. There is one psychiatrist for 1 million people, 10 lakhs. So it's not possible for the kind of resources we have to cater to the needs of such a huge population. 10 to 20% is the prevalence of depression, depressive illness I'm talking about. I'm not talking about stress. That makes it around 4.5 crore people in Pakistan as we speak who are suffering from clinical depression. Every year, 13,000 people in Pakistan commit suicide. They die by suicide in a country where suicide is considered haram, which is illegal as per law. So these are underreported figures. We don't know what the actual figures are. They must be higher. So this is the environment where we're talking about mental health. And when it comes to seeking professional help, yes, there are huge barriers on personal level and societal level, but then the resources are not there. The quality of care that's available, that's very expensive. Most of the people, and especially young people, you see, mental health, mental illnesses affect young people more. Renal, when it comes to medical health issues, diabetes, hypertension, kidney problems, liver problems, they usually start in middle age, old age. Whereas mental health problems, most of them start from age 15 to 29, where suicide is the second leading cause of death after road traffic accidents. And that's where our priorities are. Every 40 seconds, a person is dying of suicide, which is more than cardiac issues. And we don't care. We have 65% of our population, which is below 30 years. And we don't know what their health needs are. Their health needs are mental health needs. Their health needs are not physical health needs, as I'm talking relatively. Of course, we all have physical health needs, but primarily they have mental health needs, which I'm talking about evidence. They have depression, they have anxiety, they have substance use problems, they have psychosis. Nobody is looking at that. So there's dearth of resources, there is dearth of qualified professionals who can offer help. But having said that, there are some organizations which are offering. I wouldn't name them. I wouldn't. I think it's people go and search for them. They can do some of their deep study where they can look for organizations which are offering free of cost help. Public sector hospitals, although there is huge amount of rush there, but they offer free of cost services, both outpatient and inpatient, although quality of psychotherapeutic interventions is quite dismal, but still, these are the options available, no matter how minimal they are.
All right. Thank you so much for sharing that, Dr. Faisal. I mean, my second last question is about yourself. So, having had such a tremendous amount of work at your disposal, you've done a lot of research, you've worked with a lot of patients during these past years, and you've been studying this topic, being a consultant psychiatrist right now. Mashallah, you've dealt with a lot of different, a vast array of patients, a vast array of people who are going through a very variety of conditions. So in your own life, how do you deal with emotional trauma, anxiety, and tragedy?
You see, just like any other person, just like a surgeon would do, just like a banker would do, just like a gynecologist would do. So it's important, firstly, as I mentioned before, to take adequate rest, to look after my diet, to be connected with my friends and families, to play with my kids, to spend a good time with my parents and my wife. And that's how these are your resources which fulfill your life. And to have some hobbies like reading, like watching movies, like your spiritual connection, praying. Uh, um, these are your supports which keep you going, and then talking to someone. And someone can be anyone. It can be your wife, it can be your husband, it can be a friend, it can be someone you trust who's wiser than you. And sharing your everyday, you see, it's just like I talk about. I tell my patients that you vomit out your stress every day. You empty your dustbin every day. You don't carry it to the next day, because that's only going to build on the burden. That pressure cooker is going to fill up, and it's going to burst one day. So release it on everyday basis. Uh, so these are the not one strategy I adopt. I think multiple that I just mentioned.
Thank you so much, Dr. Faisal. My final question is, if you would like to share anything to the audience right now, as they're living through a pandemic, as we're all living through a pandemic, we're going through very tough times, unarguably the hardest tough times faced by humanity. And we're all secluded in our homes. We've lost jobs, we've lost lives. We've gone through a lot. We've gone through an unspoken, unprecedented amount of anxiety, tragedy, and chaos. So is there anything that you would like to share with the audience? What would that be?
You see, firstly, time never remains the same. Change has to happen. If, so this time will pass. But I know it's been too long. People are exhausted. People are tired of being locked up in their homes, of wearing masks and everything. Uncertainty is prevailing. You see, my advice would be step out of your bubble. Go connect with people. Be kind to others. Do something for others. Be it in the form of money, If you don't have money, do it in some other way. Share your knowledge, share whatever you have, share your money with others, share your resources with others, lend a helping hand to others. Kindness, charity is so contagious. It just has a snowball effect, and it comes back to you. So when we are helping others, actually we are helping ourselves. So it's very important that during these times of crisis, we hold each other's hands. We have this sense of communal belonging, and that's only going to take us forward. That's only going to take us through this crisis.
All right. Thank you so much, Dr. Faisal, for being here. I honestly believe that this one session has proved to be very productive, has proved to be very helpful for so many people who would be listening to this talk right now or later on in the future. Thank you so much for being here, for your time, for your expertise, for sharing your vast knowledge, for sharing your experiences. And we would like to be, associated with you further in the future endeavors as well. Thank you so much for being here, and I would like to wish you the very best of luck. And to everyone, this is my message. We're living through unarguably the very tough, the toughest of times. We've already, shared our knowledge about that. We're going through a lot, and the stress is just building up every single day. Just like Dr. Faisal mentioned, he mentioned a series of ways. He mentioned lots of things that comes under the the one approach that we can deal with the mental health issues. And I would like to share this. I would like to summarize the whole thing. That sharing is caring. You need to be, first of all, resilient, and secondly, you need to understand that we're going through it together. We're all in this together. And thirdly, that we need to share this as much as possible. We need to release all of our stress. We need to release it on a daily basis if we have to survive this pandemic. Once again, thank you so much, Dr. Faisal, for being here. It was a lovely evening.
Gee, thank you. I enjoyed the conversation.
Thank you so much. Take care, and Allah Hafiz.
Khuda Hafiz.